Hello, ladies and gentlemen. My name is Jay Park, and I'm from Arizona School of Dentistry and Oral Health Postgraduate Orthodontic Program. I'm honored to be part of this opportunity and would like to express my sincere gratitude to the selection committee for your kind invitation. I also would like to thank you all for your participation here today. Welcome to my presentation, Facilitated Applied Learning in Virtual In-Person Classrooms. The innovation I'm presenting today is the Diagnosis and Treatment Planning Seminar Series. It transfers teaching that formerly had to be done in a classroom to an online setting. In short, it is a discussion-based virtual class offered bi-weekly to help students to prepare to be a well-qualified orthodontist. During the class, our first-year orthodontic residents present their own initial treatment cases, while the second-year residents present their progress cases. Other students in the audience are encouraged to ask questions. This allows students to actively engage in learning and to reflect on their own work at ASTO. Also, during the classes, faculty members stand by to provide feedback to deepen the students' levels of critical thinking that mimic the conditions they will experience in the real world and during the actual clinical exam. This seminar series is innovative in the way that it allows for training that used to be done in the classroom to be done in online setting. Due to the worldwide pandemic, we have faced unprecedented changes to our curriculum. For the past 2 years, we have had a limited ability to interact with our students. Despite these difficulties, our students must still press forward and pass the American Board of Orthodontics ABO scenario-based clinical examination. Thus, it became important for us as educators to adapt our classrooms around a new virtual environment without sacrificing a high quality of teaching and education. The old examination format required records that detailed how patient cases had already been treated. This required considerable time and experience before a candidate could be certified. The new scenario-based examination focuses more on the upfront planning processes for an effective treatment outcome of cases that orthodontists have already treated. The new exam format is much more interactive, and therefore it requires a more interactive preparation, which is better done in a classroom setting. Let's take a closer look at the ABO scenario-based clinical examination. Currently, I'm working as an ABO director and ABO written exam committee chair. I'll be the ABO president in 2024. So, what does the scenario-based exam look like? The examination is composed of 4 domains for assessment that are graded on a pass-fail basis. The first domain is quite important because if the data and diagnosis are not right, it's unlikely that outcome will be optimal. The treatment objectives must be realistic and achievable, or the patient won't be satisfied with the outcome. The planning must be directed at achieving the objectives. Treatment implementation and management is the active domain where the earlier domains are put into practice. Finally, the critical analysis and outcomes assessment considered how effective the other 3 domains were and can consider such factors as long-term retention of the outcome. This table includes some examples of elements that must be included in the cases presented. With tremendous help from our amazing technologically adept staff, our virtual classrooms are now a key feature to our digital infrastructure. Because of this, these seminars do not require additional software or cost for our students. In addition, the flexible conditions of the seminars allow us to scale our discussions to suit the information that we wish to teach. For example, our format can easily be adjusted to suit any health science topic even outside of dentistry. Finally, and perhaps most importantly, this class allows for a way to build and maintain the great community we have here at ATSU. By promoting intellectual discussion between students and faculty, we have ensured our students are prepared to critically think about and discuss their diagnosis and treatments. With a complete education in hand, our students are well equipped to go forward and protect the public and promote great patient outcomes. Thanks to a lot of hard work, all our recent graduates have all made it and passed the ABO scenario-based clinical examination in February 2021 and are now board certified orthodontists. In conclusion, I would like to express my appreciation to AT Steel community for giving me a chance to share what we have been doing. I'm very happy with the outcome of this virtual seminar series, and I believe it truly facilitated higher levels of critical thinking, interpersonal communication, and ultimately social responsibility among our students. Thank you so much for your kind attention.